This time I'm going to be assessing the patient's orders. I'm going to be walking into the patient's room. I'm going to introduce myself as Crystal Garcia, the RN that will be assisting in your tracheostomy suctioning today. I'm going to ask the patient to verify their name and date of birth. I'm going to make sure that all the records match. I'm going to ask the patient and confirm that there's no allergies to latex, iodine, or shellfish. I'm also going to make sure that the patient is alert and oriented ×4, which she is. I'm going to make sure that the patient has no pain. She has expressed no pain, and 0 on a scale of 0 to 10 on the pain scale. I'm also going to educate the patient on what we will be doing here today, which we will be suctioning your tracheostomy area due to secretions and high aspirations and respirations. I'm going to ask you that if you raise your hand if at any time in the procedure you feel some sort of difficulty, nausea, vomiting, or any difficulty breathing. The patient has understand and the education prior to the procedure. At this time, I'm going to wash my hands, provide the patient with privacy, and I'm going to don new gloves. I'm going to assess the patient's vital signs, and I'm also going to listen to her anterior 6 lung sounds and the posterior 8 lung sounds. Make sure that there's no adventitious sounds, which there is not. I'm going to then grab an ambu bag, and I'm going to hyperoxygenate the patient for about 3 to 4 times slowly. I'm going to then wash my hands and don gloves. I'm going to make sure that all the tubes behind the patient there's no kinks, there's no brokens, there's nothing wrong with them, and they're fine. I'm going to check the oxygen and make sure that it's anywhere between 80 to 120 of milliliters of mercury. And then at this time, I'm also going to open the catheter tray. I'm going to be putting some of the saline solution, after I've confirmed that it is not expired, into the tray. And I'm going to wash my hands, and I'm going to don my sterile gloves. Okay, my sterile gloves are on. I'm going to walk back to my sterile field. I'm going to use my non-dominant hand to grab the most unsterile part of the catheter, which is the white part. I'm going to make sure that my non-dominant hand stays on it throughout the entire procedure. And then I'm going to use my dominant hand to grab the catheter, make sure that within the saline it does work properly, there's no kinks in it. Then I'm going to insert about 10 to 20 centimeters into the patient until I feel some sort of resistance. And then at that point, I'm going to, after also making sure that the white part is connected to the proper suctioning, I will also start pulling back when I feel some sort of resistance. I will pull back about 1 to 2 centimeters, and then I will start suctioning intermediately as I pull out, never as I'm going in. At that point, I will suction for about 10 to 15 seconds at a time. I will do that for 2 to 3 times at the maximum. And then I will get rid of all my supplies. I will take off my sterile gloves. I will wash my hands and don new gloves. I will assess the patient's oxygen, which is one of the main priorities. And then I'm going to reevaluate the patient's vital signs and reevaluate the patient's anterior 6 lung sounds and posterior 8 lung sounds. I'm going to make sure that the patient is in no type of discomfort. The patient is overall well, and that there's no signs of like fainting or nausea or anything of that sort, or no oxygen. And then I'm going to document all my findings here today. I'm going to document the color, the odor, the type of drainage that came out when we suctioned. And I'm going to then consult with the provider.